All right, so test taking strategies. All right, when you're taking a HESI or an NCLEX, you need to read the question very, very carefully. A lot of times, people know the answers, but they misread the question. So you need to make sure you read it very carefully and very slowly. It's not reading like a regular reading. I read very fast, but when I read these questions, I read very slow because you have to digest each piece of the material. Certain things, look for your key concepts. Look for who is your patient? What is the problem? What's being asked? Because NCLEX, they like to put in all this information about this is your patient, he has this problem, and this is what's going on, and then your question is going to be down here like, how do you deal with the family member? But your brain is going, oh my gosh, these are his vital signs, and this is what he's got going on, and I think he's got congestive heart failure, and blah blah blah. And then it's like, how do you handle a hysterical family member? So they like to just mess with you. They try to get your brain all working over here and then ask you a question over here. It's on purpose. It's on purpose because we want to make sure that you are critically thinking, and we want to make sure that you know the material. So it's the way of, basically it is a tricky way to make sure that you really know what you're doing. So pay very close attention, read the question very carefully, understand what it's really asking. Pay attention to the time frame. We'll talk about that in a minute. Reread, rephrase. Know what the question's asking you to do. You really should read the question, read the first answer. Think, does that match? Read the question again, read the second answer. Read the question, read the third answer. A lot of people like to read the question, read the first answer and go, oh yeah, that's it. That's it. Well, nursing is very unique because every answer is probably correct. Every answer, very likely, all the answers, not always, but often every answer is correct, can be correct. The thing is you have to find the one that's most correct. Most correct. That's where it gets tricky. Visualize it. Visualize yourself when it's asking the question. Visualize yourself doing it, because sometimes you skip over things. You get overwhelmed with the more things that you would consider to be major and skip over the minor. A good example of that is you've got a patient that you see is laying on the floor in a pool of blood, and you're going to go assist that patient. What's the first thing you do? And you have options like, you're going to check the patient, make sure he's okay. You're going to stop the bleeding. You're going to call for help. You're going to wash your hands and put on gloves. Your mind, you're visualizing that patient going, oh my gosh, I got a patient laying on the floor in a pool of blood. I had to go take care of the patient. And you completely skip over the fact that when you walk into that room, the first thing you're going to be doing is like foaming in with hand sanitizer and grabbing gloves. Because you're not going to go run somebody's got blood with no gloves on. That's standard precautions. So that's where you get messed up, because you're thinking patient, whereas you need to be thinking standard precautions. Standard precautions, safety is always key. And it may not even be safety for the patient, but you got to think about safety for yourself. So visualize yourself doing it. If you're thinking about, I'm running into a patient's room and he's laying there in a pool of blood, visualize what you do. Because a lot of times we get in the habit of, we just do these things automatic. We run in, grab gloves, run and take care of the patient. Well, that's an important step. Don't minimize the importance of putting on gloves, because in that situation, that would be the correct answer. Identify your key words. Key words. You're going to have a lot of key words. You're going to have most, least, first, last. Patience. If it's going to describe the patient, NCLEX does not waste their time and waste ink describing a patient if there's not a reason for that. You will see, and it's kind of fun when you're reading questions to look. A lot of times they'll say, a patient has this condition, a patient has this. Sometimes they'll say, an elderly patient has, or a pregnant patient. So those words that describe the patient, they're there for a reason. They are there for a reason. If you see a descriptive word for your patient, you need to immediately stop and think, all right, I got to get my brain together thinking about what kind of special considerations I need to make for an elderly patient, or a pregnant patient, or a pediatric patient, an Asian patient, African American patient, because there's going to be something there that you need to be putting in your brain, and something that you need to stop and think about. If you look at questions and it just says the patient, I mean, it's like I said, it can kind of be a game almost, where you're like, oh, aha, they're trying to get me. Hello. They have a sign-in sheet right there. You want to sign in? Eliminate wrong answers. That's the first thing you want to do, because a lot of times there's just things that you outright know are not right. It's like, this is not right. I always say scratch through it, but obviously with the NCLEX, it's computerized, you can't do it. So mentally scratch through it. And if you scratch through and eliminate your wrong answers, you could possibly get down to 50%, at least 2 questions. And then you just got to figure out, all right, I got 2 choices here. Now I need to figure out which one is the right one. Your odds at 50-50, that's a whole lot better. Look at the answers, does it relate to the question? It may be completely correct, but if it doesn't relate to the question, then it's not the correct choice. We talked about this, looking for your keywords, early or late symptoms, most or least. Those are things that get people all the time. I give exams, I have people that get things wrong, and then they come and look at it, and then I'm like, oh, it's because it says least likely. Question I had yesterday was, it said least timely, and that tripped up a bunch of people. They're like, least timely, and I'm like, yeah, slow, slow. Oh, okay. So pay attention to those things. Initial, it says initial, that's first thing you want to do. Said a lot of times, if there is a choice in there as far as your answers on standard precautions, hand washing, putting on gloves, initial action, that's usually it, because that's going to be the first thing you're going to do. Always think about your first step in your nursing process. You know our nursing process, right? What's our nursing process? ADCI, that's right, ADCI. Assess, diagnose, plan, intervention, and evaluate. Always think about that. Think about your nursing process. We always assess before we intervene. Always assess before we intervene. We do nothing until we assess it first. Got to think about your nursing process. Essential. Any kind of essential question, you've got to think safety. NCLEX is testing you to see that you are a safe and competent nurse. Safety is priority. Essential things you have to do first, and you got to do it. You have to do it. Priorities, you got to think about Maslow's. We'll talk about Maslow again in a minute. Keep them breathing, keep them safe. People like to say, oh, if there's an answer that has to do with breathing and airway, then that's the answer. Usually, but not always. It's not an absolute, but typically if they're not breathing, then nothing else matters, right? You have to remember, think about things that's going to prevent complications. Got to keep people safe and alive. This is another test-taking tip that's not 100%, but it is just something to kind of keep in mind, because usually it's the odd man wins. If you have an answer, all of your answers are really short and you got one that's really long, or if all your answers are really long and one is really short, the odds are that the one that's different is going to be the correct answer. And you gotta remember, Sesame Street. Remember, one of these things is not like the other. So, not always, but it's usually something, a little hint that you kind of look at and go, why is this one different? What about this? If two of the answers kind of say the same thing, but in different ways, such as poor appetite or anorexia, or if they say hypotensive or low blood pressure. Well, it can't be both, right? They're just trying to trick you up because it's saying the same thing, it's just using different words. So you can eliminate them because it can't be both answers. So that's a good way to start eliminating. And opposites. This is a really good question here. When it gives you an answer that has hypotension or hypertension, that's a hint that it's going to be one of them. It's going to be one of them. Adult is admitted in shock. Which assessment finding would you expect to find? Elevated blood pressures, low blood pressures, slow pulse, flesh color. Well, okay, so obviously then I got some opposites here. I got an elevated blood pressure, I got a low blood pressure. So it's going to be one of those. That's when you got to start using your knowledge, your nursing knowledge of how does a patient present that's in shock. They're going to be hypotensive. So, boom, there you go.
And it's when they're hemorrhaging, is elevated blood pressure, right?
Think about that. If you're hemorrhaging and you're hemorrhaging, you've got blood loss, right? So blood volume. If your blood volume is decreased, think about like a garden hose, and you don't have very much water coming out of it. Is it going to come pouring out faster, or is it going to trickle out? If you don't have a lot of water, is that water going to trickle out of that hose, or is it going to come out really fast? It's going to come out slow, right? So if you don't have a lot of blood volume, it's going to be less, which is going to be a hypotensive. You're going to have low blood pressure. That's why when patients have low blood pressure, one of the first things we do is put them on fluids. Give them fluids. That's the first thing we do. Pretty safe, pretty easy. If they're hemorrhaging, we're going to give them additional blood. We're going to give them just some fluids to increase that blood volume. Because the same thing is when people have high blood pressure, that means you've got too much pressure in there, too much. What's the first thing we do? So we give them a diuretic. Right. Give them a diuretic. Give them to start peeing. So I think about it as like with the hose, because that's basically, you think about, that's your vascular system. And if you think about it that way and think about the amount of blood, that's an easy way to kind of visualize it. All right. Absolutes make answers wrong. If it says you always do this, you never do this, chances are good that that's wrong. Because in nursing, it's more of a usually, we frequently, often. We don't really deal with too much always and nevers. It would be, I think, probably a lot easier job if it was a boys and never. It'd be a very black and white job. We have to critically think, and that's why it's kind of a, more of a frequently kind of thing. We talked about this, reading the question carefully, eliminate your wrong answers. Answers got to relate to the question. This gets people every day. They see an answer that's correct and go, oh yeah, this is awesome, and this is great, and this is correct. But it has nothing to do with the question. So it may be a true statement, but it's not true for this question. If you don't know the answer, if you don't know it, and you've already eliminated, and you just flat out don't know it, don't sit there and stare at it, because it's not going to just mysteriously float down out of the sky and pop into your head. If you don't know it, move on. I watch when people take HESI exams. I can't see questions or anything, but I can see what number of people are on. And sometimes I'll see people sit at the same question for 8 minutes. And I'm just like, okay, if you're staring at a question for 8 minutes, you don't know it, move on. Typically it's geared that you should be doing a question a minute. So if you have an exam with 50 questions, you should be doing it in 50 minutes. Rounded out, roughly. So you stare at a question for 8 minutes, and let's say you're taking NCLEX and you get 235 questions. You're going to be exhausted. You're going to be mentally exhausted. Move on, because too often when people get a lot of questions, they get tired, and then they just start clicking. I just want to get this over with, and I don't care at this point. Don't do that. Don't do that. Also, that's why I say practice, do a lot of practice questions. A lot of practice questions. You should be doing at least 100, and that's a minimum. Really, 150, 200 questions a day. One, because it's a skill. It's a skill. You're using your nursing knowledge, but you're using the skill of learning how to answer questions. You are going to improve your test taking skills by answering all those questions. But on top of that, you are building up your stamina for answering that many questions, because it's exhausting. You wouldn't want to go out and run a marathon when you can't even run out to your car, right? You want to start off slow. I'm going to run to my car, then I'm going to run down the block. Same thing with answering questions. Because if you get to the point where you're in the habit of answering that many questions every single day, your body becomes accustomed to it. You become, increases your stamina. So when you sit down to test and you're getting 225 questions, you're not going to wear out as soon. Because that is definitely what people do. They get close to probably around 120, and then people start giving out. But I just want to get this over with, I don't care. And that's not going to be good. You're not going to have good results. What if? Don't read into the question. Don't do what if. NCLEX world is the utopian, perfect, wonderful world. You have all the staff you need. You have all of the equipment right there in front of you. Everything's there. Don't do what if. Well, what if this? Just take it, read the question and answer for that. Don't start bringing in all this other stuff, because that doesn't exist in NCLEX world. NCLEX world is, it is what you see. Also, determine if the question's a positive or negative event. What does that mean? We'll talk about the positive, negative in a second. Remember, again, looking for your words, your early, late, immediately, most likely, least likely. Pay attention to the most likely, least likely. That gets people too. They see likely and they completely miss the least or most. Pay attention. Positive, negative. You know what these are. This is when you have to choose the option that's correct. Negative is when you have to choose the option that's incorrect. Meaning, you're teaching a patient or talking to a patient about how to give himself an insulin injection. Which statement indicates he understands? So then you would choose the statement that is correct, showing that he understands. That's a positive. The question could say you're teaching the patient how to give insulin injections, and which statement shows that he does not understand. So now you have to find the statement that he makes that shows that he needs more instruction. That's a negative event. Pay attention, because that gets people all the time. All the time. Pay attention. Am I supposed to look for the right one or the wrong answer? Priority questions. Every time anyone takes NCLEX, and they call me and say, ooh, I took it, I'm freaking out, I don't know if I passed or not. My questions are going to be, how many questions did you get? Did you get a lot of select all that apply? Because select all that apply are the toughest questions you can get. NCLEX is a very smart exam. It adapts. If you get a question wrong, it's going to take a step back and the next question is going to be a little bit easier. If you got the question correct, it's going to give you a little bit more difficult question. Most difficult questions are the select all that apply. They're the ones that give us all a little bit of heartburn when we see those. But select all that apply, if you get a lot of select all that apply, that's usually a good sign. They stress you out, but you got to tell yourself. I know when I took it, I got a lot of select all that apply, and I was like, not another one. Why? But then I thought, all right, just chill. This is a good sign. So
I got that. It didn't work in my favor.
it didn't work. Well, if you got a lot of select all apply, then did you get your candidate report, the report that showed were you like close?
Yeah, but it still didn't work out for me. But I did get a lot of.
Well, that shows that you were doing well, and maybe in that particular area you were doing really well. Because you can have different areas. You can have areas that you did everything you need to do, but in another area you didn't quite meet the bar. The problem is you got to meet it in all areas. So you probably got select all apply in the area that you're doing really well in, and then there's another area that you need to. But that's good, because that will show you use that report to help guide what you need to work on. But the other, I lost my train of thought, with the select all that apply. But I also ask people, what kind of questions did you get? What were they? What were they about? Now, I hear all the time people say, "Oh, I did really good on the HESIs, and I heard the HESIs are a whole lot harder than the NCLEX." What's your opinion on that?
I believe that the HESIs to me are harder than the NCLEX, and I do well on the HESIs, but I didn't do well on the. So
that's how I was too.
yeah.
Yeah, you felt like, because see, a lot of people that I talk to say they're kind of the same.
Mm-hmm.
They're kind of the same. They don't believe the HESI is really harder than the NCLEX. They said it's kind of the same.
One of the ladies that graduated with me last Friday before last, she had took her state boards the day before, and she said that the NCLEX was easier than HESI, but over half of her test was just on maternity.
Well, really interesting.
Select all that apply for maternity.
For maternity.
Mm-hmm.
And that's interesting, because where you never know. It
Mine
depends.
was a lot of mental health.
A lot of mental
And
health.
I have a hard time with
See, it
mental health.
finds where your weak area is, and it goes, oh, you're kind of weak in this area, so I'm going to just keep asking questions. And he's asking questions because the test wants to determine that you have a full understanding, that you understand that content area. So that's why it's so different. No matter who you talk to, person you spoke to had maternity, mental health. What about you?
I think yours was more like safety.
Safety?
I think I have more of that.
Yeah, so it does, it kind of finds like an area that you're not strong in and just keeps on. So it does, it changes, it's an adaptive exam. That's what makes it a little bit more challenging. Because you can't just go, oh, I don't know that much on maternity, but I'll probably only get one or two questions. So, no, not the NCLEX. That's not how the NCLEX works. Keep losing my train of thought. So basically, the other part of that is people say that they get a lot of priority questions. A lot of priority and delegation. Priority and delegation. Do you guys have this book? Priority and delegation, you'll have it? It's all priority and delegation questions. But even in your Saunders, the online portion, there's a whole section on priority and delegation. So go to the online. Do you ever go into the online NCLEX, your NCLEX, the Saunders book right there? The online
Yeah, that's
one?
what I've been studying.
Okay, perfect. Because you can drill down to what area, and the priority of delegation, that's huge. That's a big area. Now, priority. When you're answering a priority question, you got to remember the acronym MANS. MANS stands for Maslow, your ABCs, nursing process, and safety. Those for a priority. Got to put it in that order. Maslow, your ABCs. Now I know with our BLS training we do CABs now, circulation, airway, breathing, but with this we still do airway, breathing, circulation. Your nursing process and safety. Priority questions require you to use the skill of prioritization of nursing action. When it's priority, most likely all of your answers are going to be correct because they want you to put it in order of what's the top priority. Here's Maslow. In case y'all forgot about Maslow, you gotta know Maslow. You gotta know Maslow's forever. That's what I tell all of the students. There's certain things. Nursing school is one of those that you can't just memorize and dump. You gotta remember this stuff forever. You've got certain things. Maslow's, your Erickson's, Kubler-Ross stages of grief. Those are all things that you've got to remember, you've got to know forever. Maslow, physiological, that's on the bottom. You have to meet those needs first. If you're doing a priority question and it's going to ask you about food or water, but then there's also going to be an answer that has to do with emotional health or how they're feeling, well, obviously that is way up here near the top. You got to worry about the basic needs first. If you don't have your food, your breathing, your water, you've got to think about your physiological needs before you worry about psychosocial. Psychosocial comes after the physiological. If you can't breathe, then nobody really cares if you're depressed. You're probably depressed because you can't breathe. Fix one, the other one will follow. Got to worry about safety. Once we know those basic needs are met, then we think about the safety. Okay? Got to remember Maslow. There's your nursing process, your AMPI. Assess before you do an intervention. I say this 100 times because I see people want to do an intervention before they assess. Assess before you intervene. If you don't know what the problem is, you can't fix it. I have a really good example that I always use now, and Bridget's going, oh Lordy, because she's going to know what this is, because we did a priority, it was a practice question. Basically, you're swimming in a lake, and so you're swimming in a lake, and all of a sudden somebody comes up to you and says, hey, I think someone's drowning over on the other side of the lake. So what do? Your choices are get a canoe and try to go over there to help them, call 911, get your strongest swimmer and have them go out and help them, or do you grab your binoculars out of your backpack and look to see if they're drowning?
So
all of them are correct. I mean, all of them
They
are
are
correct.
all correct,
But
yeah.
I have learned this with NCLEX too. Sometimes the most craziest answer is the right answer. So if we're gonna use the nursing process, we do need to assess. So we would look through binoculars to make sure the person.
Absolutely, we are assessing before we do an intervention. Getting a canoe is an intervention. Calling 911, that's an intervention. Getting your strongest swimmer, that's an intervention. We are going to assess, because they came up and said someone may be drowning, might be drowning, so we're gonna assess. We're gonna pull our binoculars out of our backpack and we're gonna look. Bridget said, I don't swim with a backpack, and I sure wouldn't have binoculars in them. And I said, no, that's a what if. Because if they're giving you that as an option,
Yeah.
then we're swimming with a backpack with binoculars, aren't we? So assess before you intervene. That's, and you think, well, that's not even, that was actually a practice NCLEX question. I mean, it would be really awesome if we got a question when you go on the NCLEX, right? But bottom line is, it wants you to make sure that you understand the nursing process, that you have to assess before you do an intervention. Client needs. Client needs, it's 15% of NCLEX, safe and effective care. Questions test the concept that the nurse provides in nursing care, collaborates with others, and protects clients and others from hazards. Clients and others, patients and others. We get focused sometimes on the patient, and we think about the patient, that sometimes we forget that we got to protect ourselves or our staff. And so you have to think, when you're thinking safety, you got to think about everybody. You're not there just to protect your patient. You got to protect yourself. That's why we put on the gloves, right? The person laying in a pool of blood, well, we want to help them, but we're going to protect ourselves first, because the gloves is protecting yourself. Sarah says right here, remember the importance of hand washing, call lights, bed positions, and use of side rails. You get all caught up in all the nursing stuff that we know and all the content, when the answer could just simply be washing your hands, because it's not simple. That's huge. You got to think about safety. You got to think about things like the importance of the bed in the lowest position, call light, personal belongings, cell phone. One of the top reasons people fall is they're either one, going to the bathroom because nobody's answering their call light and they got to go, or their cell phone's ringing and it's on the other side of the room. So they're trying to get to that cell phone and then they fall. So you want to make sure bed's in lowest position, 3 side rails up, not 4, right? What's 4? You consider a restraint. So you put 3 up and push their bedside table up. So that's kind of, make sure they have access to their glasses, their cell phone, their call light is within reach. Those things are huge. We don't really think of it, considering all the other stuff that we know and we know we have to do, but that is huge. It's the very basics. Physiological integrity at 60% of your NCLEX. That's the concepts. The nurse provides comfort and assistance with ADLs and care related to the administration of medication. Medication administration, that's huge, especially with safety of medication administration. Reducing potential for complications related to treatments, procedures, or existing conditions. You need to be aware of what complications. Again, there's Maslow again, physiological needs. They're always a priority. That's why people always say, oh, if I see an airway as an answer, or, they're any kind of breathing complication. Yeah, that usually is always priority, but not always. Not always. Not if you've got a thing where they're going to go in and assess a person's breathing, but one of the answers is the first thing you do is put on gloves. You're going to put on gloves before you even go in and assess, right? Psychosocial, 10 to 15%. Test the concepts. The nurse provides nursing care that promotes and supports the emotional, mental, and social well-being. Again, psychosocial is only important as long as the physiological needs have been met. promotion and maintenance, 15%. Test the concepts to assist in directing nursing care to promote and maintain health. Promote, maintain health. Smoking cessation. Not living a sedentary lifestyle. Diet. We kind of talked about this. It's just a repeat of all those words that are kind of close-ended, like the all, must, only, never. Umbrella option. Sometimes you're given an option that kind of encompasses a lot of things. So it's a very broad or universal statement. Typically, if you're given an umbrella option, a very broad statement, often that is correct. Here's an example. Clients admitted and diagnosed with urethritis caused by chlamydial infection. The nurse assigned to the client understands that what precautions are necessary to prevent contraction of the infection during care. Got enteric, contact, standard, wearing gloves and a mask. So you got to think about protecting yourself from this infection. So obviously you're going to go with your standard precaution because that's your umbrella. It's very broad. Fourth one just says even wearing gloves and mask. Okay, well, whatever. That's not even, you know. So that's a very broad term for protection. Delegation. Delegating is big. Delegation, you gotta think about with delegation, you have to think about the scope of practice of the person you're delegating to. Every state is a little bit different. There is your Nurse Practice Act. It's on, like for Florida, it's on the Florida Board of Nursing website, the Nurse Practice Act, and it lists out the scope of practice. RNs, LPNs, CNAs, MAs. You don't want to delegate a task to someone that is not within their scope of practice. You have to think about, first of all, are they licensed to do it? Can they, then you have to think, can they do it? You have to think about the patient's needs. Is this person the appropriate fit for the patient? Meaning, you could have a little 90-year-old lady that wants to go to the bathroom and is calling for help, and you're delegating it to a CNA, which is perfectly fine. CNAs are licensed to take somebody to the bathroom, but the only CNA you have is a guy, a male, maybe a young man. Well, you got to think about things like some elderly women, they may not want a young man helping them go to the bathroom. Opposite, you could have an elderly man that doesn't want a young lady. You could have an elderly man that has dementia, that was a prisoner during World War II, and you have an Asian CNA, and he freaks out when he sees her because he thinks that he's back in the prison from war. You have to think about these things. You're going to have people that are white that don't want anybody black. You're going to have black people that don't want white people. Don't get offended. Don't get offended. It is what it is. I've had people not want me to take care of them because of their own, like usually something bad in their life has happened. It is what it is. You're there to take care of them. If they don't want you to take care of them, don't try to talk them out of it. Just, okay, get somebody else.
One of my online NCLEX questions was, I think it was Jewish or Irish, one of those people, they asked about, I think it was their rights or their beliefs or something. It was a silhouette identify. And one of the answers was, after they pass, they don't want the opposite sex to I guess
like
clean them
prepare their
up.
body.
Right. So you're supposed to do everything before the funeral home even come and get them because their beliefs is the opposite sex don't touch them. And I had never even heard of it.
Yeah, you have to be very
Beforehand.
culturally sensitive. You have to be, cultural competence is huge. You know, are you gonna know every single thing with every single culture? No, but you can kind of have an idea. Like now you know about that probably is Jewish, and so now you know that is, and you also, I know that Jewish people aren't real touchy. Like, and there's other people in other cultures, Hispanics.
Yeah,
They're
see,
very
I had a
touchy.
question on my practice that was where you're taking care of a Hispanic child, and what do you have to take into consideration? And I even
Contact.
researched and couldn't, and what would it be?
The eye contact
Is it eye contact?
With the
Okay.
child or the
I-
parents.
with the child, because the parents would feel like if you're not talking like to the child, that you
Mhm.
really don't care.
So you have to maintain eye contact.
Yeah, I mean, with both of them, but they want to see that you're attentive to their child.
Okay,
Not to
okay.
ignore the
Thank
child.
you,
Not to
because I was
ignore the
like, look at the, I was going, what? And I
they're
even
very
tried looking it up and
family-oriented.
couldn't find anything.
Hispanics are very family-oriented,
Mhm.
and the family as a whole. So they want you to acknowledge everyone.
Mhm.
Everyone needs to be acknowledged.
Right.
And they're very touchy.
Mhm.
They like the therapeutic touch, the patting on the back. Jewish people don't want to be touched.
Mm-mm.
I'm not saying this in, you know, I mean, I'm sure there's Jewish people who like to be touched, but typically for the culture, the therapeutic touch, the patting, the rubbing on the arm, they're like, I learned that the hard way. I had a Jewish man that had a stroke and was paralyzed, and I was rubbing his face, and he went, meh. I was like, sorry. Yeah, you know, so you're not going to be aware of all the cultures and everything, every single culture, but you need to have some cultural competence and understand and not get offended. I wasn't offended when that Jewish man pulled away from me and kind of went, eh. I mean, I kind of felt bad, and then I kind of was mad at myself, going, dummy, you know this.
Mhm.
But you don't always think about it. And I would rather give someone care and therapeutic touch than not, because maybe he wasn't that way. He may be Jewish, but maybe he did want the therapeutic touch. And I would rather give someone a caring touch than not.
Right.
And, you know, and have him like pull away or show that he doesn't want me to touch him. Some Asians are that way too. And
Jewish people are real hard to understand, because some, I noticed working, I used to work over at River Garden in the Coves,
that's where it
And-
happened, was about that thing when I was at Riverline.
and some people can be, they want that one-on-one care, they want that closeness. And then there's others that you'll see that are just as mean and nasty and hateful and moody and just, oh yeah. So I've had both realms, and that's one thing to sit back and watch different people. So it's not so much that it's the Jewish, it's just people in
It's
general.
just people in general, right? Because there's some people, I'm sure there's some of you in here that don't like to be touched. Don't shake your head, yes, because I'll go over and touch you. I do
No,
it all
I
the
do
time.
that,
So you just, like I said, cultural competence, just being aware, don't be offended, and think about it. But for like the NCLEX, when you have NCLEX cultural questions, you do need to be aware. You need to think about, like with the Asians, with the hot and cold, and certain cultures, they want everything addressed to the head of the family, the patriarch or matriarch of the family. They want everything addressed to them. So you do have to have that knowledge. Where were we with this? Delegation. So especially with delegating. So you want to be aware with delegation, the right task, meaning the person is licensed to do it. You wouldn't ask the environmental services person to go take your patient to the bathroom. They're not trained to do that. There's some things we have to know how to do. You have to understand your patient's needs, and when you delegate, can you delegate and then just forget about it? Hey, go take that person to the bathroom. Whose responsibility? I asked you to take that person to the bathroom and you don't take them to the bathroom. Who's in trouble?
Because you need follow up to make
Do
sure
the
it's
follow up,
done.
delegation, you gotta follow up. You are the nurse, it's your patient, it's your responsibility. So, So, matching the client's needs, patient's needs with the scope of practice, and again, with what other needs they may have. Pharmacology. Yeah, that's everybody's favorite word, isn't it? Farm. How was, you two, how were your, what about farm on the NCLEX? What'd y'all think?
I didn't have that.
You didn't have that many?
I didn't have that much pharmacology, and I didn't have any, dosage calculations. I
Really?
didn't
I
have
think I
that
had
one.
two.
So did you have the dragon drop? Where do we study for those? Cause
That's just prioritizing.
Priority.
That's all. That's all it is, prioritizing.
Yeah, it's usually priority where you just have to drag it and put it in
Mhm.
proper
Right,
proper
right.
order.
Cause it was one they asked about,
Have you taken the NCLEX?
no, I do my online English questions every
Okay.
day.
Oh, good. How many
What?
do you do?
75. Because I
You
go
need to get that
back,
higher.
I write down all my rationales to study, so I have to do like that. But it was one on there about how to take off a wound bag,
Oh, yeah.
and I had no idea.
So you know what you do if you get a question like that? That's why practice questions are awesome, because as practice questions, a wound vac, you're gonna be like, what? Because I don't know, we really don't really teach that in the class.
No, that was on my HESI. It wasn't on that, but I don't.
Yeah.
I've been trying to Google so I would know the steps, but I can't find the steps.
You should be able to even go to like a YouTube video and watch, do like wound vac. And do you have like your med search book? You should have, it should give you the steps for wound vac. Yeah.
When you took it, it didn't show the rationales for it.
I didn't
Look
write
at
it.
Yeah, you should be able to either go to YouTube, because it's scary being in the hospital, because sometimes even physicians are like, never done that before, and they YouTube it. And you're like, if all the patients knew, how many even doctors YouTube, or even nurses, you know? Sometimes we have things that we have to do, and we're like, I've done that before. And we'll sit there in the nurses station, you know, you think, walk by a nurses station, sometimes see nurses staring at a computer and looking at YouTube and thinking, oh, they're looking at me, they're probably learning how to do something. Not always, but sometimes. But your wound vac, that would definitely be one, taking off your wound vac, it would show you the steps. Pharmacology. You're never gonna know all the drugs. You're just not. I have a friend's daughter that's in school to be a pharmacist. She's in school for 8 years. And even when I was on the floor in the hospital, our pharmacist, there were occasionally when I would go, hey, I got this patient's taking this med, what is this? The pharmacist has a doctorate, says, I don't know, let me Google it. So how do you answer questions on the NCLEX pharmacology when you know you're not ever going to know all of them? You've taken this class before. Know your classifications, understand the classification, your class of drug. We know beta blockers end in LOL, right? You know the mechanism of action. You should know some side effects. Know that it lowers the heart rate. Know that before you give somebody a beta blocker, you should be checking their heart rate. Make sure it's not below 60. If it's below 60, you need to hold it.
If it's below 60 and not at 60.
Below 60, yeah, 60. That's always one of those things where you stand there, and I'm always in a telemetry unit, and it'd be like 60, 59, 60, 59. I'd be like, kind of a joke. But if it's wavering between 59 and 60, I would probably hold it just because it's borderline. Beta blockers, ACE inhibitors, calcium channel blockers. Know your class, know the class of drugs, a whole lot easier. And when you're taking the NCLEX, it's going to show your generic name, and it will show a brand name. And typically the brand name is going to use one that's well known, that people tend to use. Also, I do have a list in my office that any of y'all want to come see me, of the, I think the 50 most common prescribed medications. And then I also have a list of drugs that you should know for the NCLEX. So I make a copy and give that to you. That will help. Are there going to be drugs on it that are not on my list? Absolutely. But at least these are the most common. So if you're familiar with them, and again, know your classifications, that'll help you a lot.
I found myself, I had to order a new book other than this one, and I was told that it was better. It's not.
It's not.
But, in doing these, some of the questions that they give you, I'm like, I've never even heard of this drug. So I have my room set up to where I have my drug book right beside me.
There you go.
And I'll pull my drug book and look up that med.
See?
And it helps me
Perfect.
know more about the med.
And that's perfect, and that's another reason for practicing questions, because you keep practicing questions and practicing questions, you're gonna start seeing things, oh, I don't know this. If you don't know it, look it up. That's your opportunity to look it up. You're just gonna be smarter, brighter, stronger. All right, thinking about the classifications of drugs, you can even break it down sometimes. Low pressure, think about like medical terminology, low, lowers the blood pressure, low pressure. Side effects, typically side effects go along with the classifications. Beta blockers all have the same side effects. Calcium channel blockers have the same side effects. ACE inhibitors have the same side effects. Number one side effect, ACE inhibitors, what? Dry hacking cough. So, but it is what, so that's what you need to focus on. So, that's it for the test taking skills. Any questions on that? This is just a portion. We'll take a little break, and then we're going to go into some content review.